All right, moving kind of to the central phase here with lip lift and rhinoplasty. Lip lift, again, is something that has kind of been in vogue for the past 5 years or so. There wasn't much attention paid to the lengthening of the upper lip prior to that, although you can see here that these procedures have been around since the 70s. This can correct an aged and elongated upper lip or downturning of the lip at the corners of the mouth, which I know is a complaint in a lot of my patients. This can be performed in the office. Sometimes it's easier on patients if we just go for some light sedation in the operating room to get it done. But if you're a patient who wants to stay out of the operating room, we can get it done in the office. I circled these two because you can see every iteration has been done of the lip lift, both internal and external. The field as a whole has really settled on this, what we call kind of a buckhorn or a bullhorn lip lift, as well as possible corner lip lifting if we have that downturned corner. So this is what I perform. I think we'll hear from the other authors, the other presenters about what they perform, but this is definitely the most common combination that is performed for patients these days. As far as recovery, you get stitches. We use non-absorbable stitches. We get stitches out at a week, and there's a pink kind of fading scar under the lip there, or sorry, under the nose there, which for up to 3 months. So you can apply makeup to this and it hides very, very well because of its location. But it does take a few months usually for this to fade. These incisions by the lip heal much more rapidly. They fade much more quickly. Occasionally, this scar under the nose, it hides well in the vast, vast majority of patients, but occasionally it requires a little bit of a scar treatment just because it can be under a little bit of tension when we do this. So you just want to go to a provider or a surgeon who is just comfortable with scar treatments should one be needed if you're going to get this done. Again, the vast majority of patients say this is worth it to have it done. 92% of patients say it's worth it to have a lip lift. Then we get into rhinoplasty. So rhinoplasty is not typically thought of as a procedure for facial rejuvenation, but we know that the nose continues to undergo changes as far as aging throughout kind of the life of the patient. So rhinoplasty, the definition is changing the shape or breathing ability of the nose. We do it for functional reasons, meaning we change the breathing ability of the nose, which can change with aging, or we do it to change the shape of the nose. So what do we see with aging? Oftentimes the tip will droop. Sometimes you'll see a little bit of a hump right above the tip, and that's because the tip itself continues to kind of fall with age and fall off of the cartilage structures. We can see a little bit more of a bulbous tip over time. You can see this nasal hump, whether up here or down here, that can kind of reveal itself. Some patients do get asymmetry of the nose as time goes on. And then, as I said, we have studies to show that with aging, some patients will get what we call nasal valve collapse or reduced nasal airflow, which you may notice over time. All of this can be addressed with rhinoplasty, both functional and cosmetic concerns. 91% of patients in general, whether it's for functional, cosmetic, 91% of patients say that it's worth it to have their rhinoplasty done. As far as recovery, this is kind of a nice graph. So you see here, you get your peak of swelling in about 2 to 3 days. We take off the cast off the nose at about a week. Usually you see us right afterwards. We take out any stitches and we take off the cast. You do see a little bit of swelling right after that, just because we kind of release the hounds of swelling after we take the cast off. And then that quickly drops off. After that, you see kind of, we call this cyclic swelling, where you'll wake up, you'll say, all right, it's a little bit swollen. It goes down throughout the day, kind of changes day to day. And then at about, 2, 3 weeks, most people will not notice that you have any swelling in your nose. It's really nice in this day and age of masking. People can hide their nose for much longer than 2 or 3 weeks, but typically then most patients are not having any noticeable swelling. You may notice it in the mirror because you know your nose better than most people. At 3 months, we'll often say at least 60% of the swelling is gone, but we say that rhinoplasty healing continues for up to a year. So we tell patients often, you don't have your final rhinoplasty result for a year. And this kind of varies. So I'll talk about different approaches and the recovery associated with those, but this does vary based on skin thickness. Thicker skin tends to swell more, and it does vary based on the approach used. So as far as approaches, when we discuss those, open rhinoplasty, when we say open, we mean we make an incision under the nose here. It's on the bottom of the nose. This area also is perfectly selected. It is very resistant to scarring or to any kind of showing afterwards. So we purposely place this here because it doesn't show. So that's an open rhinoplasty. Closed rhinoplasty is simply avoiding that incision and working only through the nose here. Some people argue that closed rhinoplasty is maybe a little bit less powerful. You can get less powerful kind of results with closed rhinoplasty, but I find that I can get good results with closed as well as open rhinoplasty. And then one newer thing is preservation rhinoplasty. It's popular in the past 5 to 10 years. And what that is, if you look here, that is making changes to the base of the nose, so way back here instead of way up here. And when we make changes to the base of the nose, we're really not altering the interaction of the part that sticks forward on the nose and therefore the part that everyone sees. So by limiting our dissection and our changes to the base of the nose here, it really does limit swelling, it improves recovery, and most importantly, it puts us at less risk of having any irregularities or contour deformities of the nose following rhinoplasty. Important to know about preservation rhinoplasty, it's fairly limited in its offerings across the country, but especially in Chicagoland, there are very few surgeons offering it. And patients are very carefully selected. So we select patients who will benefit from preservation rhinoplasty. It's just important to have your surgeon be sure that you're going to benefit from preservation rhinoplasty as opposed to one of these other approaches.